First, I'm going to ask my patient to hold out her extremities. Next, I'm going to look for any skin integrity, any edema or discoloration. Next, I'm going to palpate the brachial artery. Then I'm going to palpate the radial artery. Next, I'm going to check her capillary refills, and her capillary refills are supposed to be less than 3 seconds. Next, I'm going to check her muscle strength. I instructed her to hold out her extremities, and I applied forceful pressure to the top of her hands and instructed her not to let me push them down. Next, I instructed my patient to grab both of my fingers and squeeze with excessive force to check the strength in her bilateral hands. I instructed my patient to move her arms and wrists in a circular motion to test the range of motion in her hands.
When listening to the lungs, it takes a lot of practice because you will hear the heart also. Remember that the right lung has 3 lobes, superior, middle, and inferior, and the left has 2, superior and inferior. So you will assess at the top of the lungs, which is your apex, and work your way to mid-auxiliary. Have them take deep breaths or say 99. You work your way from left to right and compare the sounds of the area. Then you turn to the posterior back and assess the lungs in the same motion. Sounds that you are looking for are normal and abnormal findings, such as crackles, which is normally connected to pneumonia, wheezing, which is obstruction of the airway, like with asthma, and absent sounds, which is normally connected to lung disorders that inhibits transmission of sounds.
Now we're going to assess the abdomen. When you assess the abdomen, make sure that you start in the lower left quadrant and work your way clockwise. You also want to make sure you listen to the aorta, and you can listen to both renal arteries and both iliac arteries, as well as both femoral arteries if you need to. Here again, you hear me listening to the bowel sounds. You want to listen for a minute, and you want to hear about 5 to 30 bowel signs per minute. If you do not, you want to listen for a total of 5 minutes to make sure that you at least hear something. Here you see me turning the stethoscope around to the bell. Once again, we're listening for vascular sounds. So we're going to start with the aortic, and then we're going to move to the left renal artery, and then we'll move to the right renal artery, and then you'll see me go down to the right iliac artery and the left iliac artery. And again, you can test both femoral, but you don't have to. Here you see me palpating lightly, looking for any lumps or any masses. You would ask the patient to let you know if they feel any tenderness or any pain. Now I'm doing an example of a deep palpation, and again, just looking for any lumps or masses.
Common questions you would ask a patient when assessing bladder and bowels are you having any trouble or pain when urinating? What color is your urine usually? Do you have a history of urinary tract infections or burning when urinating? When asking about the bowels, you would ask questions like, when was your last bowel movement? What are your normal bowel habits? What is the usual consistency of your stools? And do you experience any abdominal pain or bloating when you are about to have a bowel movement?